At the time of independence in 1963, Kenya's population was about 9 million people. Today, the population stands at 38 million people, more than 4 times the number of people in 1963, and it is continuing to grow. Even with HIV deaths taking a toll on Kenya's people, the population will keep growing. At the current growth rate of 2.8% each year, Kenya's population will increase to more than 42 million by 2012 and 51 million by 2020. One result of rapid population growth is an overwhelming pressure on land and resources. Agriculture plays an important role in Kenya's economy. Yet, the high potential agricultural areas account for only 20% of the country's landmass area, with the remaining 80% of the land being arid or semi-arid. In those high potential areas, population pressures have led to an increased subdivision of land, leading to lower agricultural productivity. This phenomenon is threatening food security and the country's overall economic growth. In some parts of the country, the population density tops 300 people per square kilometer.
Niko na watoto 11. Sasa shamba ni haka tu kadogo, ni pointi karibu 3. Sasa hapa tuna shida. Ni vile unaona tu hivi, hapa wamekula wiki moja, imeisha. Pengine tunalala njaa na tukipata siku moja tunakula.
Rapid population growth is already posing many challenges for the economy and the government's ability to provide adequate social services, especially in the context of high levels of poverty, low levels of education, environmental degradation, and food insecurity. This state of affairs became even more alarming when the 2003 Kenya Demographic and Health Survey revealed that the country was losing ground with its family planning program, as evidenced by a slowdown in uptake of contraceptives, a slowing of the trend towards smaller families, and a continued high number of maternal deaths.
We're talking about the contraceptive prevalence rate, which is plateauing at 39%. We're also talking basically of high maternal mortality. We are having 414 women dying out of 100,000. And all these indicators really need to be improved upon.
This downward slide is in total contrast to earlier decades when Kenya was on the right track, aiming to balance the rate of population growth with sustainable development.
Due to the massive population programs put in place by the government, we were able to have fertility transition start somewhere around 1989, when we recorded evidence of fertility decline. Between 1980s and up to somewhere around early 2000, we were able to see that fertility, which had started declining and was declining very rapidly, moving from TFR of 8 to TFR of about 4.7, that was a massive decline.
From the late 1970s to the mid-1990s, Kenya was a leader among African countries in providing family planning services. The use of modern contraception among married couples increased from 4% in 1978 to an impressive 32% in 1998. As a result, the average number of births per woman, or the total fertility rate, fell from about 8 to under 5 births per woman during that 20-year period. It is only with a manageable population growth rate that Kenya's economy will be able to flourish.
If the economy is growing and the value of the goods and services in the economy is increasing and the population is falling, what it means that you have more wealth at your disposal. Yeah? And with this more wealth, you can be able to do or carry out many activities, including building the requisite infrastructure to cater for that smaller population.
The trend towards smaller families directly translates to greater wealth for each member of the household and at the same time helps empower women to actively contribute towards the economic growth of their families, their communities, and the nation as a whole.
If they have a bigger load in terms of the size of the family, their effectiveness is introduced, and so we believe that family planning has a central role in improving the life of women, and particularly for Kenya, where we have Vision 2030.
Anne, a 25-year-old shop owner, and her husband Isaac are living with their child in Kiambu. They recognize the benefits of family planning for improving their chance of greater economic prosperity.
Mimi wakati nilipata mtoto wangu ndio nilifikiria kupanga uzazi ndio niweze kufanya kazi yangu, sababu tuko na kazi na sasa watoto wengi wataanza kutuconfuse kwa kazi na tunataka kufanya kazi. Sasa ndio tuliongea na yeye na ndio nikaenda na mzee, ndio nikaenda kwa family planning, nikauliza nataka nini, nikasema nataka no plan, sababu haitanisumbua na pia sitakuwa natoka hapa ndio naenda huko kila mwezi. Sasa hiyo nitakaa nao miaka 5. Nimeamua kuwa na watoto wawili na waachane na miaka 5.
Milka and Paul were squatters in the Kinale forest. Milka believes that family planning has helped turn her life around.
Ni vizuri sana kupanga. Kwa sababu ukipanga uzazi, najua wameniona vile, wanajua vile maisha yangu ilikuwa. Kuna wengine tulijuana kama sina mtoto, walikuwa naona vile maisha yangu iko. Wanaweza sema vile na mimi nawaambiaga mimi napangaga na tumiaga hii.
The Kenyan government and a large number of grassroots organizations placed a high priority on providing family planning services, which helped women have their desired number and timing of children and improved the health of mothers and their babies. Recent research shows that family planning can prevent 1 out of every 3 maternal deaths by allowing women to delay motherhood, space births, avoid unplanned pregnancies and unsafely performed abortions, and stop childbearing when they have reached their desired family size. After giving birth, family planning can help couples space their children by waiting at least 2 years before trying to become pregnant again, thereby significantly reducing newborn, infant and child deaths. In the 1980s and early 90s, the family planning services provided in the clinics and through community-based family planning programs were helping to improve the health of Kenya's mothers and children and were a role model in Africa. Health professionals from around the world came to visit and observe these programs.
The family planning program was very strong. There was a lot of donor support in the area of family planning in terms of right from buying the commodities, advocacy issues, BCC materials, all those.
In the last 10 years, there has been a significant erosion of these impressive gains. Attention has shifted to other health and development concerns, even though, ironically, attention to family planning would make the achievement of other health and development goals more feasible.
HIV and AIDS, due to it being a very major pandemic, resources were shifted from family planning and other programs to be able to tackle that very critical concern in our community.
Between 1998 and 2003, modern contraceptive use stagnated at around 33% with no measurable change over this 5-year period. Family size also has remained more or less constant at around 5 children per woman for the last decade, a worrisome trend. This situation may result from a number of factors such as the failure to sustain and manage family planning services and the failure by the government and other stakeholders to reinforce family planning policies and services in the wake of other issues that continue to emerge. The fact that Kenya's once vibrant family planning program has lost ground is a major cause of concern.
If the fertility continues in the upward trend, which it showed in the last DHS, I think it would be disastrous for this country.
The current focus on control and management of HIV/AIDS in the country has left most family planning providers with fewer resources and products to satisfy a responsive clientele that they had served over the decades. Community health workers were adequately trained and provided valuable family planning services, often bringing information and supplies directly to people's homes. Today, they have neither the resources nor support to enable them to provide services to their clients in the community.
Hii huduma tunazipatanga mara nyingi kwa shida kama sasa. Saa hii ukienda unaweza kuta huko ukifika aje unaambua dawa zimeisha, wakati mwingine shindano. Sasa unajua hapo kumeleta shida sana.
Hizo mandawa hazitoshi kwa sasa. Iko wakati ule mbeleni kabisa ilikuwa inatosha. Tulikuwa tunaletewa nyingi sana na serikali, lakini kwa siku hizi haziko za kutosha.
Mr. Musungu, a barber in Kakamega town, is among former community-based distributors who lament on the failure to sustain a program that was working very well. His focus was on the youth and the middle-aged in his community.
Katika kijiji changu kulikuwa na karibu watu 40 wenye ambao nilikuwa nahudumia. Hasa sio wamama sana, walikuwa umri ya kadri. Bado niko na wale wateja ambao wananiulizia mambo yetu inaendaje. Sasa naambia nyewe, unaona kliniki ambayo tulikuwa tunahusika nayo iliweza kufunga, sasa imeweza kuwa ya mtu binafsi. Hasa ukienda huko utapata gharama sio ile ya kawaida ambayo tulikuwa tunaweza kupatia.
Most people, regardless of their social and economic standing, were aware of the benefits of planning their families.
Bring up 2 kids, it's quite a challenge. I think now my family is complete.
Mimi ningekuwa na watoto wengi, ningekuwa na shida. Ningekuwa na shida ya kutafuta vyakula kwa sababu mashamba yenye tuko nayo itoi chakula kwa njia mzuri. Sasa ile kidogo yenye napata imenitosha na watoto wenye niko nayo 3.
Due to the decline of family planning services in the country, many cases are now emerging where parents or families are having more children than they can afford to provide for. Naomi Kavaya, who lives in the Kibera slums of Nairobi, is a classic example of the many people who are now suffering as a result of the slowing down of the formerly active family planning campaigns and services that existed in this country. Today, she is a widowed mother of 9 surviving children at the early age of barely 30 years. She has had 9 pregnancies with 2 sets of twins. At such a relatively young age, the health risks to the mother and the children alike are very high, not to mention the economic burden of comfortably raising and caring for such a large family.
Mtoto wangu wa kwanza nilimzaa 1986. Watoto wote kwa jumla walikuwa 11. Na wamekufa 2, wamebaki 9. Kuna wale hawasomi. Kuna mwenye amemaliza form 4 hana kibarua. Kuna mwenye ako form 2 hata hajaendelea na kusoma, hako tu. Alafu na hawa wadogo.
The Mkomani Bomu Clinic in Mombasa struggles to maintain family planning services for its large clientele. The clinic has a group of volunteer community health workers working within their communities. Their resources, as well as support to reach a wider number of clients. The work of different churches and religious groups like the Catholics and Muslims who advocate for the use of natural family planning methods needs to be recognized and fully supported.
The church has its own position, it has its own stand. Natural